My name is Erin. I was born on Ngangkari and Wadawurrung country in Ballarat, and now I have the privilege of working at both cohealth in Footscray here in Melbourne and also across several ACCHOs in southwest Victoria on Gunditjmara country. I'm also a Carlton supporter, so please be kind. As a doctor, I've had the incredible privilege of working as a GP alongside many First Nations people. I'm currently into my 4th year of working in Gunditjmara country, and the journey has been incredible to this day. Today I actually wanted to share with you all some of my journey working with First Nations communities and just how enlightening it has been to me, both personally and professionally. I do get a bit emotional, which is why I've got my notes here, just in case I get a bit teary. As a medical student, I think back to the time when I was about 19, trotting off to my first Aboriginal community to live and work there. And I remember thinking that I had all the good intentions, with a very strong focus on providing good medicine. What I left with, though, in return was a profound education and shift in my perspective, with listening and collaboration being at the heart of this learning. And this learning has continued throughout my career, shifting and shaping with every community I work with and for. As a doctor, having the honour of learning from Ngangkari in the Territory, with their knowledge of traditional healing methods, plant-based remedies, and the absolute importance of the spirituality and well-being of people impacting on their health, it has enriched my practice in ways that I could never have imagined. As a doctor working with the Aboriginal nurses and health workers of the Central Desert and Top End Northern Territory, learning how to sit quietly, observe, not fill silences with my incessant chatting, and to learn the huge power of non-verbal communication. As a doctor working with the phenomenal community health workers and Aboriginal nurses here in Melbourne and also in regional Victoria, I have witnessed their knowledge of the inner workings of family networks and how this impacts illness presentation and, more importantly, healing. Learning together has been a two-way street. As a GP, I have shared my medical knowledge and parts of my story, but I've also learned about, and it's a buzzword, but I can't think of a better peoples to embody this word, the resilience of Aboriginal people and their deep connection to family, to pride as a people, and to the land. As a doctor, I have seen how much all of these connections have an impact on well-being. And it is through this lens that I now treat all people coming to see me. It's what I teach my registrars coming through. It has transformed me as a person and as a doctor. I take the time to listen and understand each person's perspective, unique background, and experiences. This approach has not only improved patient well-being, it has also led to more effective healthcare outcomes for all of my patients. So in summary, my experiences collaborating and learning with Aboriginal people has been a life-changing journey. It has reshaped my perspective on healthcare and the care that I provide to others. I am so grateful for these lessons that I have learned. So we sit here today with the opportunity to vote yes, to gain over 60,000 years of wisdom, and that will enhance our understanding of health and well-being, of how connections to one another and connections to those things important to us impact our health, how we express our sickness, and how we heal. We have a chance to vote yes and advance how we care for all people in Australia.